Hi guys, happy Wednesday. Okay, detox and dental talk. If you catch this live, let me know. If you catch a replay, let me know. Touch my face, make sure you've followed me. I am maxed on capacity. I'm gonna hashtag sprinkle and click that arrow out. If you share this out, I'm actually gonna put this in some of my beauty pages I'm in. But anyways, yeah, feel free to follow me. Feel free to share this into any of the beauty groups that you're in. We're gonna be talking about, hey Shay, hey Nikki. I don't come live on my personal page enough, I know. Pregnancy and teeth issues, dental work, dental health, a lot of unknown things, and share this because somebody is pregnant somewhere that probably needs to hear this. So let me put this on. I like to come hang with y'all while this sits for about 5 to 7 minutes. So I'm gonna keep it really short and sweet. I just exfoliated my skin, so if it looks red, that's why. This is one of my hands down favorite masks. So I'm a mask girl that likes masks that you wipe off, not peel off. But anyways, looking to see it working. Oh, girl, you better work. Okay, and in case you didn't know, well, I can only speak for Texas. I don't really know any other states, but they have opened all dental practices to kind of go back up and running. We actually have a meeting tomorrow to see when we're all going back. Anyway, thank you, Vicki, for sharing. Hey, Wendy. Hey, Amber. So I want to just kind of talk about some things. So first things first, I'm going to get this off the table. Dental x-rays are not harmful when you're pregnant. Okay, back in the day, yes, guys, when there was so much scatter that nobody could even be in the room with you, much less the person taking the picture, okay? Now, x-rays are so localized that we literally stand in the room, we have the x-ray gun, we shoot it at the tooth, it's done. You don't even need lead aprons because the scatter's it's just so localized. It would take 50,000 dental x-rays a day to hit your x-ray quota. So if I can, thank you, Crystal, for sharing. I use this mask once or twice a week. I use my exfoliating a couple times a week, and I use my hydrating once or twice a week, and they are phenomenal. Anyway, but so don't be afraid of dental x-rays, no matter where you're at in life. Even if you had x-rays 6 months ago, but didn't we do x-rays the last time? Yeah, but we've also seen people lose teeth within a year's time because they didn't get x-rays every 6 months, okay? So to me, I wish people could get their teeth cleaned every 3 to 4 months. I wish they would do 3 or 4 times a year by insurance, and I wish they would do x-rays all those times too, because if you can catch something early, you can fix it, okay? Speaking of fixing it, if you have a cavity, y'all, pregnancy can cause cavities. I've never had a cavity in my life until I got pregnant with Corbin. And it was an internal, like, resorption cavity, meaning you couldn't see it anywhere except on an x-ray. When they open it, it's not like it was like soft decay. It was just what we call my Corbin cavity. So I've officially had 1 tooth filled. But also cavities can happen because snacking starts happening when people are pregnant. A lot of people get in the mindset like, ooh, I'm eating for 2, so their eating habits increase. A lot of people crave sugars, you know? So it is hands down. I put my mask on with, it's a foundation brush, but I don't ever use this type of brush for foundation. Oh, I see a cute baby. I see a cute baby. That one?
Yeah.
Oh, regular food?
No.
5:30?
Wow.
Oh, 8.
Oh.
8:30, yeah. Anyways, so also don't let your insurance dictate your health or your dental health, okay? With this also said, if you need work done, guys, kind of do it in your 2nd trimester when the baby's really like, the organs are all there. If it's an emergency, it can happen. Like I had this cyst removed and my mole removed. I was about 2 weeks pregnant, probably 3-4 weeks maybe. I didn't know, so I did have local anesthetic. It's fine, everything's fine. But really, ideally, you're not really supposed to be around having anesthetic or be around nitrous, so never have nitrous when you're pregnant. But if you have to have dental work, do it in your 2nd trimester. With that said, 60 to 75% of pregnant women have gum issues because your hormones, your blood is pumping. So you have puffy gums, bleeding, all these things, right? So majority of girls that get pregnant also have gum issues. So be diligent with your home care, guys. Good electric toothbrushes make a difference. I am the first to tell you I was anti-electric toothbrushes because I never found one I loved. I made myself start using my Sonicare. I never loved it, and then I splurged on a Burst, and my husband was like, do you need a new toothbrush? I'm like, no, but I need to try it, and I fell in love with it. So we swapped all of our toothbrushes here to Burst because it is the best brush on the market. Plus it's super soft, which is what you need when you have gum issues, okay? Is something that's soft that's not gonna like destroy your mouth, right? Because that was my number one complaint with electric brushes was they're so hard. I hated it. It took me forever. And if Bailey loves her Burst, she will be the first to tell you that she doesn't like electric brushes. It was almost a debate at dinner one night. But it's super soft. It's got charcoal bristles like my mask, but I just love it because these tapered bristles, those long skinny ones, get around and in between, which is what you need if you have gum issues, or even if you don't. Everybody needs it because nobody's flossing properly, I promise. But guys, if you start to have gum issues, get into the dentist's office, and you may have to go more than, you know, some people tell me their insurance covers more when they are pregnant. I don't know. I don't deal with insurance. I just deal with teeth, but that's awesome if they do. That's pretty cool. But anyway, with that said, gum disease, like gingivitis, if it's untreated, can turn into periodontitis. There is a difference. Gum disease is curable. I mean, not gum disease, gingivitis is curable. It's just bleeding of the gums. It has nothing to do with the bone. It's just the tissue. But if you let it go, it turns into the bone becoming infected, and that becomes periodontal disease. That is not curable. And that can cause many other health issues, including when you're pregnant, low birth weights, and preterm labor, okay? So pregnancy, y'all, if you get pregnant, I mean, women are machines. I mean, if you really think about it, you grow a human. Like within one day, they're in your stomach, and then they're in your hands, and then they're eating on you. Like women are mind blowing. Like they run this world. Like men, I love you because you can't have a baby without me, but like it's crazy what our bodies can do, but it's also crazy what pregnancy does to your body, to your hormones, to everything, okay? So no, as I'm like catching my breath because I have no room in there, but yes, they do have good, awesome dental floss. I think they're coming out with another toothpaste too. Anyways, but I just wanted to come on here and reiterate. I know I don't talk about it a lot because I mean, granted, I've been pregnant for 2 years, I feel like, but literally. Anyway, share this. Somebody you know is pregnant. Somebody you know is pregnant and having gum issues. These are things that people need to be educated on because honestly, gum disease doesn't hurt. And a lot of people don't go to the dentist's office unless they hurt. And by the time something hurts, it is extreme. So anyway, I really wanted to come and educate that because it's really good to go to the dentist's office when you're pregnant. Now, I think that's it. Oh, and if you can get $30 off with my hygiene code. That's like I was thinking about that the other day. I was like, that's like a $30 gift card for a bomb toothbrush. That's really awesome to me that they allow that. So anyways, if you want that, you can message me or just ask for it. But Brandon and I love our Burst brushes and toothpaste. I do love their toothpaste. It's very natural toothpaste, very mild. But anyway, yeah. I don't know what else to tell y'all except for brush your teeth and floss, even if you're not pregnant, okay? Okay. My mask has officially sat there long enough, that's why it's dried. But I'm gonna get off of here and wash this off before it becomes permanent. But I love y'all, and thanks for hanging with me. And don't forget to follow my this page because I'm maxed on friends, or unfriend me, I guess. This is your time to unfriend me. If you don't want to be my friend, because I probably won't notice, sadly. So anyway, love y'all, and I'll see you later.